Hello everyone, I'm Professor Lee of Dr. Wild Herb TV. As you know, cardiovascular disease is the number one cause of death. One of the 4 risk factors for cardiovascular disease is hyperlipidemia. However, more than half of Korean adults over the age 50 have hyperlipidemia. Herbal remedies, when used properly, proven to be effective in hyperlipidemia. There is a synergistic effect when combined with diet, exercise, or drug therapy. Now, part 1 of the lecture on how to use the world's top 10 medicinal plants. Let's begin. Before I talk about medicinal plants, I'll summarize the basic things you need to know about hyperlipidemia. The 4 major risk factors for cardiovascular disease, the number 1 cause of death worldwide, are high blood pressure, diabetes, hyperlipidemia, and smoking. Among these, I have already introduced the top 10 medicinal plants that are effective in improving diabetes. Today is a lecture on the second risk factor, hyperlipidemia. The correct term is dyslipidemia, but since the term hyperlipidemia is more familiar, I'll call it hyperlipidemia. After the lecture on how to use the top 10 medicinal plants for hyperlipidemia, I introduce high blood pressure as next title. According to a paper reported in the Journal of the American Society of Preventive Cardiology, for every 18% reduction in bad cholesterol, LDL cholesterol, the risk of death from cardiovascular disease decreased by about 15%. This means that LDL cholesterol must be reduced to reduce death rate from cardiovascular disease. Other risk factors other than the 4 risk factors are family history, that is, if a family member has a cardiovascular disease, age, a man over 45 years old and a woman over 55 years old, not exercising, and depression or stress. Obesity or metabolic syndrome are also at high risk of cardiovascular disease. Please check if any of you fall under these risk factors. Let's look at statistics on hyperlipidemia among Korean adults. In general, the standard for diagnosing hyperlipidemia is when the bad cholesterol, LDL cholesterol level is over 160, the triglyceride level is over 200, or the good cholesterol, HDL cholesterol, is below 40. Based on this, among Korean adults in their 20s, the rate is 26.6%. The people in their 30s have hyperlipidemia, 40.8%, and over 50% of people in their 50s and 60s have hyperlipidemia. Hyperlipidemia is more common in Europe and America than in Korea. You all probably have regular checkups every day, but the most common abnormal finding after checkup is hyperlipidemia. To treat hyperlipidemia, you need to have a target level, right? However, did you know that unlike high blood pressure or diabetes, the target level for hyperlipidemia is different depending on age, gender, and other disease? For example, the most important target level for LDL cholesterol is 160 for some people, but for others it is 130, and in some cases it is 100 or 70. In some cases, medication may need to be started when the level exceeds 55. I'll tell you in detail, so please check what your target number is. This is the cases when the target level of LDL cholesterol must be maintained below 55. If you have hyperlipidemia and have other coronary artery disease, for example, if you have hyperlipidemia but have angina or myocardial infarction, your LDL cholesterol level must be maintained below 55. If your LDL cholesterol level is above 55, lifestyle modification must be made and you need to treat it with drug. If the side effects of drug therapy are severe or difficult to control, herbal remedies can be added. If LDL cholesterol level is maintained below 55, you can use lifestyle modification without drug therapy. In this case, it is very good to combine medicinal plants. Let's talk about your target number is less than 70. You may have a stroke or have carotid or peripheral artery disease or have diabetes and one or more of the following risk factors. Men 45 years old, women 55 years or older, have high blood pressure, are a smoker, have low HDL cholesterol, or have a family history of coronary artery disease. For example, if you have diabetes, are 50 years old, and have high blood pressure, your LDL cholesterol target level should be less than 70. Another example is a female diabetic patient who is 50 years old and has a family member with angina pectoris or myocardial infarction. Even in this case, the target level of LDL cholesterol must be maintained below 70. If it is above 70, the drug treatment is needed. However, if it is below 70, and if you continue to correct your lifestyle habits and combine medicinal plant therapy, you will see very good results. Let's talking about when the target number is 100. If you are diabetic and do not have cardiovascular risk factors, your LDL cholesterol level should be maintained below 100. For example, if your LDL cholesterol level is 80 or 90, so it is less than 100 and is good. The following are cases where the target number is less than 130. In this case, you have 2 or more cardiovascular risk factors. For example, if you are a man 50 years old and have high blood pressure, you should maintain your LDL cholesterol level below 130. If you are well below 130, it is very good to combine the exercise and diet with medicinal plant therapy. If it is above 130, medication may be needed. LDL cholesterol target level is less than 160. In this case, you have 1 or less cardiovascular risk factors. For example, if you are a man over 45 years old, if you are a woman over 55 years old, or have one of the following among high blood pressure, smoking, or a family history of coronary artery disease, your LDL cholesterol level should be maintained below 160. Even in these cases, if it is over 160, you will need medications. If it is less than 160, it's best to combine lifestyle correction with medicinal plants. In addition to cholesterol levels, high triglyceride levels also increase the risk of cardiovascular disease. If the level is over 500, drug is needed. While correcting lifestyle habits and drug therapy, medicinal plant therapy can be added only in cases of drug side effect or poor control. If the triglyceride level is 200 to 499, and also your LDL cholesterol level is high, you will need to take drug. However, if your LDL cholesterol level is at an optimal level, it is better to combine lifestyle modification and medicinal therapy without drug. Among the treatment methods for hyperlipidemia, the most important are exercise and diet. If you don't do these 2 things, doing the other things won't have much effect. So they are so important that you must do that. First, let me talk about weight. Even just one thing, weight control, can be effective in treating hyperlipidemia. If you lose 10 kilograms from your current weight, your total cholesterol level will decrease by about 8.9. Alternatively, losing as little as 3 to 5% of your current body weight can make a big difference. For example, if you currently weigh 80 kilograms and lose just 5% or 4 kilograms, your LDL cholesterol level will decrease by 5, and your triglyceride level will decrease by 15. Not only that, your good cholesterol will also increase by 2 to 3. Second is diet. Foods that must be avoided because they increase LDL are animal fats, butter, cheese, margarine, fried foods, snacks, cakes, chocolates, cocoa, etc. These animal fats should be avoided and instead eat good foods such as fish, beans, tofu, and lean meat. You need to change your eating habits. In the case of alcohol, drinking just 130cc glass of alcohol a day increased triglyceride level by 5 to 10%. Therefore, if you have hyperlipidemia, it is recommended to abstain from alcohol as much as possible and only drink no more than 1 or 2 drinks a day. Lastly, exercise. It is best to combine the two exercises. First, you should do aerobic exercise, that is, exercise that makes you slight out of breath, at least 5 days a week. If you do this, HDL, which is good cholesterol, will increase by 1 to 2. On the other hand, LDL cholesterol, which is bad cholesterol, will decrease by 3 to 4. Triglyceride will decrease by about 4 to 12. Like aerobic exercise, strength training does not need to be done more than 5 days a week. You can do it 2 to 3 days a week. Then the LDL cholesterol level decreases by about 6 and the triglyceride level also decreases by 8. In summary, just do these 3 things: weight loss, food control, and exercise are very important because LDL, the bad cholesterol, is greatly reduced to over 10, and the result is a reduction in the death rate. In modern medicine, the standard treatment for hyperlipidemia is weight loss, food control, exercise, and drug. Many people worry about side effects, but because the drug is effective, it has side effects. If you look at the side effects of the most commonly prescribed statin drugs, heartburn and abdominal pain, hepatotoxicity, muscle pain, and muscle weakness are now quite common. Second, the prescription drug ezetimibe is a drug that inhibits the absorption of cholesterol in the small intestine. Its side effects include digestive symptoms, fatigue, decreased appetite, joint pain, muscle cramps, chest pain, and liver failure. Because drug treatment is effective, treatment is performed by carefully observing these side effects and adjusting the dosage. Sometimes, the side effects are so severe that the medicine cannot be used. There are no side effects when used in small amount, but if the drug is not well controlled and when the other drugs are added or the dose is increased, severe side effects occur, which can be very worrying. In these cases, medicinal plant may be a good alternative. There are over 400 types of medicinal plants used in traditional medicine or folk remedies to improve hyperlipidemia in 37 countries around the world. Among these, I searched the medical big database by October 2023 and selected the top 10 based on the following 3 criteria. 1. A large number of clinical papers with randomized controlled trials. It will be more reliable if there were 20 to 30 papers rather than 2 or 3. 2. Many positive results were reported in each study. For example, if there are 10 related papers and all of them report the effect of improving hyperlipidemia, the reliability is high, right? On the other hand, medicinal plants that were found to be effective in some studies but ineffective in other studies were excluded. In other words, I select those that reported many positive results. 3. Although there are not many clinical trial papers, I selected top 10 by including medicinal plants that have been frequently prescribed to patients with hyperlipidemia from the past to the present in traditional medicine in each country. There is a lot of research on the mechanisms of medicinal plants. 1. Inhibition of lipid synthesis. 2. After food intake, lipid components are less absorbed into our body through the small intestine. 3. Promote the movement of cholesterol in the blood into cells. If this happens, the cholesterol level in the blood will decrease, right? 4. Promote the breakdown of lipid. 5. Bile is continuously produced using cholesterol. As cholesterol continues to be consumed, it will decrease, right? 6. Inhibit lipids from being oxidized and denatured. Among lipids, the worst lipids are oxidized lipid. In particular, oxidized LDL cholesterol is one of the most important factors contributing to arteriosclerosis. Looking at the 6 mechanisms above, medicinal plants have all the mechanisms as drug. It is only less powerful than drugs. However, medicinal plants have other advantages that drugs do not have, such as antioxidant activity, anti-inflammatory effect, liver protection, intestinal bacteria improvement, etc. In addition, medicinal plants have other effects besides lowering cholesterol, making them a very valuable and useful treatment. According to a comprehensive analysis report of over 130 papers on the effects of medicinal plants until 2022, medicinal plants have 3 effects. 1. LDL cholesterol, the bad cholesterol, was reduced to 6.6 to 46.8, and total cholesterol level was reduced to 7 to 67.7. This decreased value is a significant decrease compared to the control group, so it is a highly reliable result. 2. The combination of exercise and diet showed a great synergistic effect than the medicinal plant treatment alone. 3. Even in the case of drug treatment, synergistic effects were shown when combined with medicinal plant therapy. Looking at these 3 advantages, you can see that medicinal plant is a very valuable method if used well. From now on, this is the first medicinal plant in the top 10. It's the fruit of a medicinal tree and is one of the most important plants in the world for cardiovascular disease. In addition to the effect of treating hyperlipidemia, it's been reported to improve high blood pressure and improve symptoms of angina and heart failure. What's the name of this plant? It's a hawthorn tree. The Chinese character means morning tree growing on the mountain. The sweet and sour red fruit in October is edible and medicinal for hyperlipidemia. This tree is distributed around the world, and the 2 most commonly used species are Crataegus phenotyphidae, called mountain hawthorn or Chinese hawthorn, and Crataegus scabrida, called American hawthorn. This tree is characterized by its characteristic leaf shape, which is dark green and triangular ovate in shape, with the notches on the leaves deeply split down to the middle of the leaf. If you want to find this tree growing along a mountain valley, keep in mind the shape of the leaves. The flower is a white flower with the 5 round petals that blooms in May. Among active components, the effect of improving hyperlipidemia is not the effect of 1 or 2 specific components, but the result of the combined action of various components. For example, flavonoid, procyanidin, phenolic acid, tritterpene, hyperlysine, hyperforin, and bitaxin, polysaccharide, and pectin act in combination to improve hyperlipidemia. Well, I'm going to tell you action mechanisms. 1. It inhibits the synthesis of cholesterol, so producing less cholesterol. 2. it causes LDL cholesterol in the blood to move into liver cells. So the level of LDL cholesterol in the blood will decrease. 3. Bile acid is produced using cholesterol as a material. As cholesterol continues to be consumed, the level will decrease. 4. It prevents lipids in the food from being absorbed in the small intestine. Since less lipid enter our body, the blood level will drop again. 5. Increase the action of an enzyme called lipase, which break down the neutral fat. 6. Increase the synthesis of HDL cholesterol, good cholesterol. As such, Hawthorn is a very important medicinal plant that has all the important mechanisms to improve hyperlipidemia. I'll actually find out how effective it is in clinical studies. In a total of 13 clinical studies until 2023, there were 1,420 patients, and total cholesterol and LDL cholesterol decreased by 8 to 10% after taking Hawthorn extract for 2 weeks to 3 months. Additionally, HDL cholesterol was significantly increased. In another study, in 60 patients with high blood pressure, after taking 450 milligrams of the extract in the morning and evening, systolic and diastolic blood pressure decreased by about 10%. Total cholesterol decreased by 11%, and LDL cholesterol decreased by 18%. Looking at this randomized controlled clinical result, there is no doubt it is effective in improving hyperlipidemia. The scent of this fruit has a subtle apple scent and a delicate floral scent. The taste varies depending on the degree of ripeness, but has both sweet and sour taste, while unripe fruit has a astringent taste. Anyway, it's berry taste even when chewed raw. I'll tell you about medicinal method. The easiest and most standardized method is to take capsule or tablet extract. You can easily buy it by searching on the internet. You should read the instruction carefully and take it as recommended. It's best to start with the smallest amount recommended. If you don't like pills, tea is good. The easiest way is to purchase the powder. Add 1 to 2 teaspoons to 250 cc of boiling water and drink it like tea after about 10 minutes. You can take it about 15 minutes before or after a meal. The daily dose is about 1 to 3 grams. You can mix the powder with food or drinks. However, it's best to drink it as a warm tea. It's also good to take as a traditional decoction herbal tea. In traditional medicine, the leaves, flowers, and fruits are all used, but the fruit that is collected in the fall and dried in the sun with the seeds removed is most often used. When purchasing, the red ones are better than black ones. Domestic products are smaller than Chinese products. When making herbal decoction using traditional medicine, 2 to 20 grams of dried Hawthorn is used per day in 1 liter of water. After decoct for about 100 minutes, take it like tea 2 to 3 times a day. It's best to start with the smallest amount, 2 grams. In traditional medicine, it's been used for thousands of years to treat stomach upset after eating meat, and there are records of use for abdominal pain, diarrhea, hyperlipidemia or obesity, high blood pressure, coronary artery disease, hepatitis, fatty liver, and back pain. And even now, it's the most commonly prescribed traditional medicine for hyperlipidemia. Caution is advised to be careful in pregnant women, acute gastritis with excessive stomach acid, or gastric ulcer. Let's talk about the side effects and how to deal with them. If you experience stomach upset, nausea, diarrhea, or abdominal pain, stop taking it for 2 to 3 days and start again with a small amount. In most cases, there will be no problems. If you take a large amount or high concentration of extract, you may experience headache or dizziness. In these cases, just stop until the symptoms disappear and then start again with a small amount. If allergic symptoms occur, stop use and be at a hospital if they worsen. Since it's effective in improving high blood pressure, you may experience dizziness due to low blood pressure. So, check your blood pressure frequently and adjust the dosage. If you are taking antihypertensive or arrhythmia medications, it's recommended consult with your doctor. Precautions. If you are pregnant or breastfeeding, it's best to consult your doctor in advance and avoid using it if possible. You should also consult with your doctor when taking cardiovascular drugs such as antihypertensive drugs, antiplatelet drugs, and anticoagulant. When taking cardiovascular drugs, it's good to take Harsan as an adjunct, but it should never be replaced. As I mentioned about the LDL cholesterol target level at the beginning of this lecture, in cases where drug treatment is not necessary, it's good to use medicinal plant. But if you need drug treatment, you should not replace the drug with medicinal plant. And if you want to use it, it must be used in combination. Because the Harsan has a blood pressure lowering effect, you should check your blood pressure regularly and consult a doctor when using it for a long time. Lastly, I'll tell you other proven effects in controlled clinical studies. The most important characteristic of Mountain Harsan is that it has a hyperlipidemia treatment effect and additionally protect the heart and increase blood flow in the coronary arteries. In actual clinical studies, 1. It's been reported that it improves high blood pressure in addition to hyperlipidemia. 2. There are reports that it improves exercise capacity and fatigue symptoms in mild heart failure. 3. There are reports that it improves symptoms in unstable angina. Now I have told you everything important about Mountain Harsan. Everyone, after starting, do you like the Mountain Harsan? I'm growing about 20 Harsan trees, but I haven't been able to use them much yet, and I'm only using about 5% of them. The remaining 95% is used by birds living in the mountains as very useful food in the winter. Everyone, next spring it'll be great to buy young Harsan trees and plant them. It reproduces very well. Now this is the second plant. This is also tree's fruit. It's a tree used for food and medicinal purposes, and the sour taste of the fruit is very strong. In India's Ayurveda medicine, it's a plant that's been used for food and medicinal purposes for a very long time. The vitamin C content is about 30 times that of oranges. In addition to treating hyperlipidemia, that's been reported to have an effect on improving diabetes and chronic periodontitis. What's the name of this plant? The name of this plant is Amla. Amla is an Indian word and its most popular name. Its scientific name is Amblyca officinalis and is a tree native to tropical and subtropical region of India and Southeast Asia. In Indian Ayurvedic medicine, the bark, root bark, and leaves of this tree are used, but edible fruit are used the most. The fruit is a round fruit the size of a walnut and is called Indian gooseberry in English. It's light green at first, but gradually turns yellow as it ripens. The main active ingredients are 1. Vitamin C. 100 grams of fresh amla fruit contains 600 to 1,800 milligrams. This amount is dozens of times more than the 50 to 60 milligrams of oranges. The activity of vitamin C contained in amla is a large amount of vitamin C contribute 45 to 70% of total antioxidant activity. 2. It's rich in tannin called allergy-tannins and is very rich in flavonoids such as quercetin and camphorol. Let's talk about the action mechanisms. There are 4 mechanisms to treat hyperlipidemia. 1. Inhibit the synthesis of cholesterol. 2. Inhibit the absorption of cholesterol. 3. Use cholesterol to produce bile acid. 4. Increase the synthesis of HDL cholesterol, the good cholesterol. I'm going to tell you scientific evidence of AMNA. A total of 9 clinical studies published by 2023. 535 patients took 500 mg to 1,500 mg of capsules made from AMNA extract per day for 2 to 12 weeks. As a result, LDL cholesterol decreased by about 15.08 and triglyceride decreased by 22.35. But HDL cholesterol was increased in some studies and not in others. Therefore, the effect of increasing HDL cholesterol is still unclear. Some studies have shown that after taking 500 to 1000 mg of AMNA extract capsules per day, the degree of improvement in hyperlipidemia is similar to that of taking 10 to 20 mg of prescription drugs called statins. The scent of AMNA fruit is slightly sweet, sour, and tangy, and has a very strong sour taste. As it ripens, the sourness becomes weaker and the sweetness becomes stronger. But it's much more sour than other citrus fruit. How to take it? Since it's an edible fruit, if you live in an area AMNA is grown, remove the seed from the fresh AMNA 1 or 2 per day and make juice and drink it. To find out how to take, search on the internet and purchase the product. There are also capsule products produced domestically. Take the dosage recommended and start with small dose. In most clinical studies, the general recommended daily dosage is 500 mg capsules twice in the morning and evening. It's also a good idea to start with a minimum amount of 250 mg twice a day. Powder is also easily available. Put 1 to 2 teaspoons of powder in 250 cc of boiling water, leave for 10 minutes, and take like tea 1 to 2 times a day. It has a sour taste. Since it is strong, you can season it according to your preference. When drinking tea by traditional decoction method, purchase dried AMNA fruit, put 1 to 2 pieces per day in 500 cc of mineral water, steep for 15 to 30 minutes, and drink it 1 to 2 times per day. In traditional medicine, it's been used for fever, jaundice, empty stomach, cough, asthma, headache, indigestion, eye disease, vomiting, leprosy, diabetes, and menorrhagia. Side effects include mild constipation, diarrhea, or abdominal pain. You can stop taking it for 2 to 3 days and then start again in small amount. If you have allergic symptoms, stop taking it and visit the hospital if it gets worse. Because it's a plant that is effective in improving diabetes, it can cause hypoglycemia and disease symptoms. So, it's recommended that you check your blood sugar level, and if you are taking diabetes medications, consult your doctor in advance. One thing to notice that pregnant women may benefit from this because it's very rich in ingredients such as vitamin C and folic acid, which are necessary for pregnant women. But you need to take it for a long time to improve hyperlipidemia. It's better to consult with your doctor. When taking diabetes medication, of course, check your blood sugar level regularly and consult with a doctor. Lastly, because it has high acidity, there is a possibility of erosion of the enamel layer of teeth, so it is recommended to rinse your mouth with water after taking it. Another proven effect that's been demonstrated in controlled clinical studies. 1. The most representative and important one is diabetes. And it's been proven that there is a significant reduction in the fasting blood sugar levels by activating the action of insulin. 2. It's been reported to be effective in improving chronic periodontitis. 3. It's been reported to improve symptoms of gastroesophageal reflux disease. In addition, it improves the function of vascular endothelial cells, and when testing the body's antioxidant function indicators after taking it, It has the effect of enhancing antioxidant functions. Amla is not a plant produced domestically, so it may be difficult to purchase fresh fruit. So you can take it in powder or capsules. It's very convenient and better to use the powder as a tea rather than capsules. It's especially good to use as a tea if you like sour taste. Now, this is the third and final plant in today's lecture. This plant is so sensitive to soil and climate that it is produced only in a limited area in southern Italy, where 95% of the world's production is produced. In addition to hyperlipidemia, the fruit of this tree is effective in improving diabetes, high blood pressure, and fatty liver disease, and is also effective in improving psoriasis, insomnia, anxiety, and depression. What's the name of this plant? It is bergamot. The scientific name is Citrus bergamia. It's a hybrid plant of the tangerine genus. It was first created through natural crossbreeding of a bitter tangerine and lemon. Its etymology is begamudi, which is called king's pear in Turkish. What should not be confused with this bergamot is a plant that has same name. It's a bergamot from Lamiaceae family. Its scientific name is Monarda genus, and it's a perennial plant. It's not a tree. It has a similar scent, but it's a different plant from bergamot. This is bergamot fruit. The tree is about 2 to 5 feet tall and is similar to other citrus fruit. White flowers bloom in the summer, followed by fruit. The shape of the fruit may be pear-shaped with a protruding top or may be just round. The surface of the skin is slightly bumpy. It's green at first and changes from yellow to orange as it ripens. The main active components are 1. Fruit pulp has a much higher content of polyphenols, flavonoid, and glycoside than other citrus fruit, and this component exhibits complex therapeutic effects. 2. Oil is extracted from the peel, not the pulp. The oil contains volatile components such as limonene, linalool, and linolenic acetate, and non-volatile components such as bergamottin and bergaptin are active components. Let's talk about action mechanisms. 1. Similar to the mechanisms of statin drugs, the most important mechanism is to inhibit cholesterol synthesis. 2. It fundamentally blocks cholesterol from being absorbed into our body by attaching to the protein that transports cholesterol in the small intestine. 3. Activate the enzymes that forms high-density cholesterol, so increasing HDL cholesterol. 4. It increases the number of LDL cholesterol receptors and allow LDL cholesterol in the blood to move into cells. 5. It inhibits oxidation of bad cholesterol. 6. It has an important effect of activating AMPK. It's an important protein that regulates cell energy metabolism and cell survival and aging. In 2022, in the one research paper summarizing 131 clinical studies related to medicinal plants reported to improve hyperlipidemia, and the researchers selected 4 plants with the best effect on improving hyperlipidemia: bergamot, radish rice, and artichoke, and berberine. Of course, these 4 are included in the top 10. I will introduce them to you in part 2 lecture. What I'm talking about today is one of the 4 bergamots. Looking at the results of actual randomized controlled clinical studies, 12 papers have been reported by 2023. Duration of taking bergamot is 1 to 6 months in adults. Dosage types are 1. Extracting only bergamot polyphenol and taking 500 to 1,500 mg per day. 2. Taking 500 mg of the entire extract of bergamot and the combination of other medicinal plants. 3. statin drugs were used in a very low dose and bergamot extract was administered at the same time. Among the 12 studies, 9 reported a very significant cholesterol reduction effect. The reduction rate was 12.3 to 31.3% reduction in total cholesterol, 7.6% to 40.8% reduction in LDL cholesterol, and 11.5 to 39.5% reduction in triglyceride. HDL cholesterol was also increased. Studies in which bergamot was taken along with other medicinal plants such as artichoke extract reported that cholesterol and LDL cholesterol was significantly reduced, and visceral fat mass and waist circumference were also reduced. Bergamot smells like oranges because it's similar to citrus. Additionally, the scent is characterized by a mix of fresh lemon and a sour floral scent. The taste is a combination of refreshing sour, flowery scent, and a slightly bitter taste. When using bergamot for hyperlipidemia, it is important to be aware of the different product types. 1. Bergamot oil. Its extract from the peel is not used for hyperlipidemia, but is mainly used for aromatherapy. 2. Bergamot polyphenol is extract from the fruit pulp and has the highest hyperlipidemia treatment effect. 3. It's an extract of entire bergamot and is used for various health promotion purposes. 4. It's a complex product that combines radish rice, artichoke, and CoQ10, which have proven synergistic effect when used together with bergamot. To improve hyperlipidemia, you can take polyphenol-enriched capsules, juice, or juice-dried powder in the form of your choice. First, if you take the capsules, you must check the polyphenol content because it's the most important component. Based on the polyphenol amount, the recommended amount is 500 to 1000 mg per day, but you must follow the recommended amount for each product. To give an example of content labeling, if you look at the product in the bottle you see now, the amount of polyphenol, the active ingredient, in a 1 gram capsule is 38%. In other words, if you take 1 gram of this product per day, 38% or 380 milligram of this amount is polyphenol. If you take 2 500 milligram capsules of this product a day, you will consume 380 milligram of bergamot polyphenol. Of course, the recommended amount of polyphenol is not more than 500 to 1000 mg per day, but take this product as recommended in directions. When making decoction tea for traditional medicine, purchase dried bergamot oranges and use 4 to 12 grams per day in 500 cc of mineral water. Starting with 4 grams is good. After steeping for 15 to 30 minutes, you can drink it like tea. In traditional medicine, there are many records of men using oil. There are records of its use for various skin diseases, mainly through skin application, and for anti-stress, insomnia, anxiety, allergies, respiratory disease, and muscle pain using massage. When looking at side effects, there are no serious side effects reported in clinical studies. 1. Gastrointestinal problems are the most common. If you experience abdominal pain or little nausea, stop for 2 to 3 days and then start again with a small amount. 2. If you experience allergic symptoms, stop, and if it is severe, it's better to visit a hospital. 3. If you take statins, antifungals, and antidepressants, which are drugs metabolized in the liver, because bergamot extract may affect these drugs' metabolisms, it's best to consult your doctor in advance. Let's talk about precautions. 1. Bergamot has been reported to have therapeutic effect on diabetes and high blood pressure in the clinical control studies. Blood sugar and blood pressure must be checked regularly. 2. If you are taking diabetes medications, antihypertensive medications, or hyperlipidemia medications, it's recommended to consult your doctor. 3. When pregnant or breastfeeding, it's recommended to consult your doctor because there is not yet sufficient safety data. Lastly, I'll tell you about other proven effects. First of all, let's talk about the effect of bergamot polyphenol. 1. It has a diabetes treatment effect. It's been reported to lower blood sugar levels, reduce insulin resistance, and reduce weight in diabetic patients. 2. In the case of high blood pressure, systolic and diastolic blood pressure improvement has been reported in 16 clinical research papers. 3. Body mass index and body fat mass were significantly reduced in metabolic syndrome patients. 4. Liver fat was reduced in a fatty liver patient. 5. There are also reports of improved cognitive functions in schizophrenia patients. Next, let's talk about the effect of oil extracted from the bark, not bergamot polyphenol. 1. In psoriasis patients, when bergamot oil is used with modern medical treatment, the duration of treatment is significantly reduced. 2. Improved sleep, analgesic action, anti-anxiety, antidepressant action, the effect of anti-stress have been widely reported. 3. There are many cases where people feel very anxious during various procedures or surgeries at the hospital. And in these cases, bergamot oil through aromatherapy has the effect of greatly reducing anxiety. 4. It's also effective in improving pain relief and agitated behavior in dementia patients. This is the end of today's Part 1 lecture. You really hard for almost an hour. Today, by chance, all 3 medicinal plants were fruit. Next week, I'm going to tell you 4 medicinal plants as powerful as most prescription medications. Until the second lecture next week, everyone stay healthy and stay well.